Dr. Bhatti, I would like to turn it over to you.
Thank you, everybody. So nice to be here today on this beautiful snowy day. I'm looking out of the window, and the trees are covered with snow. So it's cold outside, but it still looks beautiful. And that's how I would like to start this presentation. We have to be grateful for what we have. We have been, had a lot of challenges in the last year. We have been dealing with COVID, and I deal with breast cancer, and breast cancer has not stopped in spite of the COVID. There's patients coming in every day with new diagnosis of breast cancer, and even though I'm a surgeon, my goal, like Judy said, is to try and have you live a healthy, cancer-free life, because prevention is the key here, and we cannot be just taking care of the disease that happens once we have let our genes and our environment take control of us. So let's look at this young lady. She is 95-year-old. She has doing a yoga pose, which frankly I could not even do it at my age, and I'm not 95 right now, but still look at her, because the way she is doing this tells me that she's lived a healthy, active, purposeful life, where she has been pursuing endeavors and doing activities which are making her young. And the 2 C's on the top mean that she's trying to beat the cancer, and she has beaten COVID. So this is what we all aspire to be. And that's why when I decided 5 years ago that prevention has to be the key instead of just curing cancer, I decided to do a fellowship at University of Arizona with Dr. Andrew Weil in integrative medicine, where I learned how to look at a person as a whole, not as different systems, but as a whole. So why are we here today? The reason that we're doing this lecture today is to understand breast cancer, understand the risk factors that cause breast cancer. We will talk about prevention, and then I want all of you to each of you should look at your own individual risk factors, because remember, all of you are unique. Each of you has your own DNA, you have your own environment, and so everybody's risk factors are different. So at the end of my talk today, I want and I'm requesting each one of you to take one change that you will make in your life to improve your health. And it could be a simple change like drinking more water, or getting your mammograms, whatever it is, but make one change and make that your goal. And once you make one change, other changes will come on also, because eventually we are all a work in progress. We all want to grow. We don't want to be at the stage where we are right now, where we have allowed COVID to take over United States. And as you know, the CDC is saying that 73% of adults over the age of 20 in the United States are overweight or obese. And we have now 400,000 deaths in the United States because of COVID. Why are we eating ourselves to death? Why are we not active and healthy like our great grandfathers or grandfathers used to be? So that's going to be the goal of my talk, mostly about breast cancer, but some references to COVID also. So this is what your breast looks like. It's made up of glands and ducts. So you see these grape-like areas are the glands, and then the tubes are the ducts that drain the milk. And our breasts are very important organs that help produce milk that supports the baby, the human baby when he's born. But also the breasts are exposed to toxins starting at the age of puberty. Our breasts are developing. The fat in the breast accumulates the toxins. And also the breast is exposed to the menstrual changes every month. And that is what is causing most of the cancers, is due to those hormonal changes that are happening every month in the estrogen and progesterone. And that results in development of cancer. Now, we are going to talk about how that happens. So let's go on to the next slide. So how does cancer develop? Normally, if you look at the top of the slide, there is one cell that divides into 2 and then goes on. But you may know that every day, every minute, cancer cells are developing in our body. And that's that green cell. Judy, if you can point at that little green cell on the top is the cancer cell. And if the body has this amazing machinery which allows it to create enzymes that allows this damaged cells to pop, or cell suicide is performed, so the cell dies. That's the body's own mechanism to prevent cancer from developing. So we do have the seeds for cancer in our body, but when we let the environment take over us, when we let our dietary habits take over us, then that, as you see at the bottom of the slide, the cancer cells start dividing. The nucleus continues to divide. You remember the nucleus from cell biology? It's the brain of the cell, and if it continues to divide and not divide in a well-organized manner, then these cells clump together and form a mass of cells that can then individually grow blood vessels. Then it can actually spread to other parts of the body and then eventually cause death of the individual. So we do not want these cancer cells to develop. We want to change the environment that's surrounding these cancer cells that are developing in our body. So most of the cancer cells will eventually die and not grow to become cancer. Let's go on. Just to give you another diagrammatic example. So the ducts look like this at the bottom, and they are like tubes. Once the cells start filling up these ducts, that's called ductal carcinoma in situ, early stage cancer. That about 25% of our patients are diagnosed at this stage, because that's when mammograms pick up this cancer, before the cancer has a chance to form a mass. Once you go to the right side of this, where Judy's pointing now, the cancer cells are coming out of the ducts, and that's when you develop invasive cancer. And we do not want invasive cancer to develop, because once that develops, then it means that that cancer has a chance to metastasize, to spread, and to develop into, cancer in different parts of the body. So this is how cancer develops. Now let's go on to the next slide. So look at some numbers. This is a projection by the American Cancer Society for 2021. 280,000 new cases of invasive cancer. Remember, guys, invasive cancer is the one that spreads. 49,000 cases of ductal carcinoma in situ. That's the cancer that does not spread. It just grows in the cells. But if it grows in the ducts, but if it continues to grow, it can develop invasive cancer. 43,000 women will die of cancer in 21. 2,600 men will get breast cancer, out of which about 520 men will die. So more men die of breast cancer by percentage than women. And that means that about 20% of men will die if they do develop breast cancer, as opposed to 1 out of 8 women, which is about who will develop breast cancer, but only Judy, one minute, please. Can you go back? Yeah, I just wanted to make a point here that 3% of women die of breast cancer, but 13% of women in the United States are at risk for breast cancer. And that's what I want you to remember. An average risk is 13%. 1 out of 8 women will develop breast cancer. And if your risk is higher than 13%, then you're at a higher risk, and we have to do additional testing for you. So next slide. So we are going to look at the risk factors now. There are major risk factors and minor risk factors. So major ones are the ones that we really cannot change too much. So let's look at them. Starting from age. Really, we cannot change our age, guys. We would love to, but we may feel younger than we are, but we are actually aging by the minute. So if you are at the age of 30, your risk for breast cancer is 1 in 204, so about 0.49%. But when you reach the age of 70, the risk is 1 in 24. And so the number of 1 in 13, 1 in 8 comes from average of all these ages. So an average woman has a risk of 1 in 8 or 13%. But if you make it by the age of 70, then your risk is about 4%, which is 1 in 24. So the risk changes by every decade of life. More than 80% of women are over the age of 50 when they're diagnosed with breast cancer. About 20% are under the age of 50, and about 10% are under the age of 40. So I have seen even 21 and 22-year-olds with breast cancer. So breast cancer can happen at any age. And as we get older, the risk of breast cancer increases, because remember that the body is being assaulted by all the environmental factors. And as we get older, these environmental factors can result in those cells kind of escaping the cell death that we had shown earlier and developing cancer cells. So people ask me, I had a patient last week who was like 85 years old, and she goes, why would I get breast cancer? I'm 85 now. And that's the point, that the older you are, the greater the chance that you can develop something in your breast. But by the same token, the older you are, the breast cancer is less aggressive. The younger you are, the more aggressive the breast cancer is because of the hormonal factors. Next slide. So our race is the next factor that can increase the risk for breast cancer. Now, every time I ask this question, which race is the highest risk for developing breast cancer? I get the answer, it's African American, but actually it's still Caucasian. But African Americans are kind of coming on and catching up. But Caucasian race is at the higher risk for developing breast cancer. But under the age of 45, African American women are more likely to develop breast cancer. And if they do get breast cancer, they're at higher risk of dying of breast cancer, which is speaking to the disparity that we see in healthcare that's available for different races in this country. And we do know that Native Americans and Asians are at a lower risk of developing breast cancer. Next slide. And we cannot really change our race. Next thing that's important is family history. You really cannot change your family history. And so I want all of you to understand, what is your family history? Does anybody in your family have breast cancer? Is it a first degree relative? So if you look at this tree at the bottom at the trunk is you, then you have your parents, then you have your grandparents, and then the great grandparents. So this is a third three generation pedigree, which means that do your parents or siblings have cancer, or your grandparents or your great grandparents? And that gives the doctors an idea of if they need to test you for the genetic mutation that has present in about 5 to 10% of the population. Then these genetic mutations make you at risk for developing breast cancer. So each of you should know your family history. And I make it a point of asking each of my patients their family history. And when they come for follow-up visits, I will ask them, has there been any changes? Because that will alert me to be thinking about sending them for genetic testing for breast cancer. Next slide. So now we're going to talk to about genetics, because remember, the cancer is arising from the nucleus, the genes. And so the genetic aspects of breast cancer are very important, but genetics are only a part of the problem. And about 80% of time, it's the rest of the environment that's contributing to developing the breast cancer. So as I read somewhere, the seed of the cancer in you is present in you, but we have to change the environment, the soil around the seed, so that cancer cell cannot sprout. So genetics is actually the seed. So let's talk about genetics. Next slide. So if you remember from your high school biology, we have the cell that is surrounded by a cell membrane. And then inside the cell is the nucleus, this round structure, which has these little crawly little things called chromosomes. You've heard of the chromosomes, which can contain a genetic material. We have 23 pairs of chromosomes in our body. And if you open up the chromosome, it's made up of genes, which are these areas which code for different proteins. And now with COVID, a lot of you have heard about the DNA and the RNA. So these genes that are coding for different proteins have to be decoded by making an RNA. And so once the RNA is formed, then the RNA forms the protein. And you've heard this COVID vaccine that most of the healthcare workers have gotten, and I've got it too. The Pfizer vaccine is an RNA vaccine, but this is the DNA that we are talking about, the blueprint of your body. What DNA makes you who you are. And we really cannot change the structure of the DNA here, but I'll show you something, some other aspects of how we can change our DNA. So next slide. So if you recall, in about, I think 2016 or so, or maybe earlier, Angelina Jolie talked about the Bracha gene. Her mother had the gene for ovarian cancer, the BRCA2 gene, so she ended up getting both her breasts removed. So BRCA genes are present in all of us, guys. So you should all know, we all have the BRCA gene. These are the genes that help repair the DNA so that the DNA does not become cancerous. So those are good genes. But when these genes are mutated means change. And that's the area that you see in red. When those areas are mutated, then you can have a higher risk of developing breast cancer. And the risk for BRCA1 is up to about 80% risk of developing breast cancer. and for BRCA2 about 40%, and then there's a higher risk of ovarian cancer up to about 40%. Average woman's risk is only 1% for developing ovarian cancer. So these genes are very important for developing breast cancer. So if anybody has a family history and develops breast cancer, I want you to get your BRCA genes tested. Even if you don't have breast cancer, that's the point here, that we're talking about prevention. If you have a mother or a sister who had breast cancer, and I get many patients like this who will come to me for unrelated things like a mammogram that looks abnormal, and they want to talk about biopsy of that area. We'll talk about the biopsy, but then when I go through the history, I find out that their mother or sister had breast cancer. I will send them for genetic testing because I want to know, what's going on with them and why they are developing breast cancer. Can you hear me? Hello?
Yes.
I suddenly got a phone call and then everything went blank. Oh boy, this Zoom is killing me. Okay, there we go. Now you can hear me? Okay, thank you. I can't, because I can't see anyone, I have no idea. Why don't you guys turn on your cameras, if you don't mind? But, or Judy, at least you turn on the camera so I can see you. Okay, now I'm going to go on. Next slide. So who should be tested for a genetic mutation? Anybody who has a personal diagnosis of breast cancer, if there's a family history of ovarian cancer, if there's a premenopausal mother or sister with breast cancer, multiple young family members with any kind of breast cancer, and males and Ashkenazi Jewish ancestry. And this is really important because Ashkenazi Jewish ancestry is important in that they have a 1 in 80 chance of developing breast cancer or having the breast cancer mutation, the Ashkenazi Jews, as opposed to the average population, which is about 1 in 300 to 500 patients who have the risk of having a genetic mutation. So there are new guidelines that were released in 2019, which said that American Society of Breast Surgeons wants everybody who has breast cancer to be tested for their genes for breast cancer. And so now we make it a policy that every patient with breast cancer goes for genetic counseling, even if they don't have a family history, because we have found some patients who are the first ones to have the mutation. And if they do have the mutation, we would want their family members to know about it. And that mutation makes a difference in how I manage that patient's cancer. Next slide. Now, so risk factor we talk about now are age, race, family history. Now, the next thing you want to know is, have you ever had a breast biopsy? I get a lot of patients who've had breast biopsies done for different things. And I'm going to ask them, what was that done for? And they'll say, I was told it's okay. I don't know what the diagnosis was. It's extremely important that each of you who's ever had a benign breast biopsy, not cancer, get a copy of the report and keep it with you, because next slide, if you have one of, next slide, if you have one of these, next slide, Judy. If you have a pathology, can we go to the next slide? Is it stuck? I can't hear you. You're muted.
Would you like me to go to the, you were stuck.
Yeah, go to the next slide, please. Yeah. So what was the pathology? Even if you never had a cancer, but if you had this kind of pathology. So pathology means we take a piece of your breast tissue, we put it under the microscope and we look at it. And that's what you see. And if you see on the right-hand side of this slide here, you see there's normal duct cells. Then you see cells that are growing called ductal hyperplasia. Oh, whoa, I have a arrow now. So that's good. And then the cells continue to grow, and then they develop these funky looking cells. That's called atypia. Atypia means unusual cells. And so once you have atypia, atypical ductal hyperplasia, atypical lobular hyperplasia, you have a 4 to 10 times higher risk of breast cancer. And then these cells go on to become carcinoma in situ or invasive cancer. So please understand your pathology. And if you do have any of these pathologies, go talk to your doctor, who will refer you to a medical oncologist who will start talking to you about chemo prevention, giving you a pill to prevent breast cancer. And that's being proactive to reduce your risk of breast cancer. I'm at the end of the slideshow. I would like all of you to tell me if anybody has ever had any of these pathologies and what have they heard about this, because this is really critical. This is taking charge of your health, not letting your doctor decide about what's going to happen, but you understanding how you're going to take charge of your health, of your own health. Next slide. Now, if you've had a personal history of breast cancer, that increases your risk 3 to 4 times. And so if you've ever had breast cancer, I recommend that anything abnormal in your breast, go talk to your doctor. I recommend getting an MRI of the breast, because that will give me more information about what to do for that breast cancer problem. And if you do have a personal history of breast cancer, if you can exercise regularly, that will reduce your risk by 30 to 40%. Next paragraph, next slide. Radiation. Now, this is not the radiation you get from a mammogram. This is being exposed to radiation before the age of 30 for treatment of different kind of lymphomas. And that increases your risk by 55 times, guys. Radiation is a big deal. And now we know that those patients are such a high risk for breast cancer that we should do an annual MRI on them starting at the age of 30. So if any of you has ever been exposed to radiation for treatment of thyroid cancer or lymphoma or anything else, you should be telling your physicians that. And I want all of you to know that be aware of your breasts, and this breast awareness should start 10 years after the radiation. So if a patient is 10-year-old at the time of radiation, by 20, they should know what their breasts feel like. And by 30, they should be getting their MRIs. Next line, next slide. So breast density, that's the next thing that's really important in terms of determining your risk for developing breast cancer. And some of you may know your breast density, some of you may not. I want all of you to know your breast density. That's called being proactive. Go look at your mammogram reports. I hope all of you over the age of 40 should be getting a mammogram every year. So if you have a mammogram, look at the reports, see how dense you are. The less dense you are, so if you have these scattered densities, or fatty replaced, which means that the breast is more gray, less risk of breast cancer. The more dense you are, 3 to 4 times higher risk of breast cancer. And so in that case, you should be getting additional testing, including whole breast ultrasound, which is what we are recommending annually for women who are who have extremely dense breasts. By the way, alcohol increases the density of the breast. So if you're drinking alcohol, cut it out. Next slide. And then finally, use of diethylstilbestrol. This is an estrogen that was given in the 60s, early 70s. It was used to prevent miscarriages in women. And at that time, the doctors had no idea that they were exposing these women to a substance that had causing higher risk of breast cancer. And now we know that these women's children, their daughters, develop vaginal cancer and have an increased risk of breast cancer. So go talk to your mothers and your grandmothers and see if they were exposed to these hormones in the 60s and 70s. We don't use them now, but this is another major risk factor. So next slide. So there are actually 10 major risk factors. So all of you should know this for yourself and decide which one that you're going to be working on to understand your own risk for developing breast cancer. Next slide. Now we're going to talk about minor risk factors. So minor meaning hormonal factors related to age at first period. So hormonal factors are due to estrogen. You've heard of estrogen. It's the female hormone that goes around our body, makes us who we are, makes us have nice hair and skin and all that. And after menopause, you know, our hair gets gray and our skin gets wrinkly. It's because of estrogen. So estrogen is good, but estrogen determines what age you get your first period. So earlier you get your first period, the greater the risk of getting breast cancer. Later that you stop having periods, greater the risk for breast cancer. Use of hormones, taking hormone replacement treatment for postmenopausal symptoms like hot flashes and vaginal dryness, etc., can increase the risk of breast cancer by 25%. We do know that. Combined hormonal treatment is a risk factor for breast cancer, but taking estrogen alone will reduce the risk of breast cancer. So, but you cannot use estrogen alone if you have a uterus. If you have a uterus, then you have to take estrogen and progesterone. But women who are on combined hormonal therapy have a 25% higher risk of breast cancer. Women who've never had children or have children after the age of 30 have a higher risk of breast cancer. And we believe that the pregnancy protects the breast. And so like, our mothers used to say, have your children early, and none of us did that. I had my first child at 30. And so we are all at higher risk of getting breast cancer. Not breastfeeding. The World Health Organization is saying that 6 months of breastfeeding protects you against breast cancer, and obviously it's good for your baby. But nowadays, with all our work and our lifestyle, we have resorted to bottle feedings, etc. So breastfeeding is good to protect you from breast cancer. Please advocate this to your daughters and your granddaughters. So go back to the next one. Yeah. So estrogen receptor, that's just a diagram of how estrogen is in the body, and the receptors are the areas in the body which attach the estrogen. And so we have estrogen receptors actually in the brain, the bones, the lung, the breast, obviously, and the uterus. And so the estrogen affects your brain. It makes your brain stay active. It affects your bones. It keeps your bones strong. So it's good for you. But when these estrogen molecules become the bad estrogens, and there are different kinds of estrogens in the blood, but the bad ones are the ones that attach to the nucleus, the receptor in the nucleus, and cause cancer. Estrogen positive cancer is seen in about 80% of breast patients. So it's due to estrogen in our body. Next one. And now I'm going to be talking about prevention. I want you to go online, if any of you knows how to do that, and go on World Cancer Research Fund website, WCRF. It's one of the really good resources talking about cancer prevention. And I'm going to go through this entire 10 recommendations, but their vision is to live in a world where no one develops a preventable cancer. Guys, 30 to 40% of cancer in the world is preventable. 30% of breast cancer is preventable. And so if we follow these guidelines, you will play a role in your destiny. Your genes are not your destiny. It's what you put in your mouth. It's what you put on your feet. The minute you put on your running shoes and you start running, you reduce your risk of breast cancer. So let's go over this, this diagram, and I'm going to go over it in the next slides. But by the way, before I go on, they say here in fine print that smoking is one of the main factors that stop the development of lung cancer. So stop smoking, and smoking is also been associated with breast cancer too. So let's go on to the next slide. So our cancer risk is affected by our diet. So you may have to do the animation here because it was supposed to come on as an animation, Judy. So we just go on to the next slide. It's okay. Next slide. Okay, so let's talk about one concept here, because I talked about DNA, right? DNA we cannot change. But if you look at the DNA at the bottom here, it's bound around these spools. These are called the histones. Histones are where DNA is bound so that the DNA is clumped together and is not opened and unraveled. Because if the DNA is unraveled, then number one, the DNA can be read by the RNA, but also getting phone calls. I'm sorry, go back to my slide again. Where did it go? Okay, so when the DNA is unraveled, then it's higher risk of getting damaged. So look down here, you have these spools and you have this chemical called the methyl group. This comes from folate actually, and it can go bind to the DNA and it makes the DNA clump together. So methylation of DNA causes nucleosomes to pack together so that the DNA cannot be translated. So suppose you have the BRCA1 gene mutation and your DNA is clumped together, then your DNA will not be able to expose that gene to cause the damage to the DNA. Now, as opposed to the bottom of the slide where you have these orange things, those are called the acetyl groups. And when you have acetyl groups attached to the histones, it opens up the DNA. It unravels the DNA, higher likelihood of reading those genes, but also higher likelihood of damaging the DNA. So remember this, that these methyl groups and acetyl groups, they all come from our diet, from our environment, from our thoughts, from everything that we are doing to our body. So everything that we are putting in our mouth, we are drinking, we are affecting, we are allowing the to enter our skin is affecting our DNA. And this is called epigenetics, the study of the environmental and other factors that affects the DNA. So it's not changing the DNA. We cannot change this DNA, but we can change the way that it is expressed. Does everybody understand this? This is a very important concept, because epigenetics is how these environmental factors are causing us to change the way cancer is going to express itself in our body. Okay, next slide. So 30 to 40% cancer can be prevented. And next slide. So alcohol damages DNA. That's one of the main risk factors, and that's in that diagram I showed you. Alcohol is a carcinogen. It was labeled a carcinogen by the World Health Organization in 1988. And it in the body is converted into acetaldehyde. It reduces those methyl donors. So remember those methyl donors I talked about? These methyl donors, I'm going to see if I can make a little red marker out of it. No, I can't do that. Okay, so the methyl donors go and attach here. So if the DNA is damaged because of the methyl donors not being there, or the histones being modified, then the alcohol will cause increased risk for cancer. Alcohol will also increase the estrogen by affecting your liver and changing the metabolism of your of the estrogen in the body. 10 grams of alcohol increases risk for breast cancer by 5% for premenopausal women, 9% for postmenopausal women. An average drink of alcohol is about 12 grams. And so if you drink two drinks per day, your risk is up to 30 to 50%. So girls, I know you like your drinks, but it increases your breast density. It increases risk for breast cancer. That is one modifiable factor that you can change by stopping alcohol intake. We used to say that red wine is good, but it's actually been found in retrospect that it's not that good. And the risks are worse than the benefits. So next slide. Next, we talk about your weight and your waist size. Now, why is that important? Our weight is one of the main factors of why we are going to develop any kind of cancer. Obesity is related to 13 cancers in our body, 13 cancers. So each of you should know your body weight, but it's not just the body weight, it's also the weight around your, you guessed it girls, your waist. Your waist determines how much fat is in your abdomen. And that fat is not the one that you pinch when you pinch your belly. It's the fat inside the abdomen. That fat is actually an organ that's producing inflammatory chemicals, causing insulin resistance and increasing the risk for all cancers, including breast cancer. That's called truncal obesity. Next slide. So this is a graph of our body mass index. Each of you, so that's another action item for all of you. Write it down, please. Each of you needs a weighing scale. Each of you needs a measuring tape. You should know your height. You should know your weight, and then go to any of these calculators online and figure out what's your body mass index, which is height divided by weight divided by height squared. And so you see here that if you're in the healthy, so let's give you an example. If a person is 5'8" and weighs say 154 pounds, 5'8", 154 pounds, you're right in the middle, in the green. Now, if you are 5'8", but you weigh 187 pounds, you are in the purple, which means that you are in the obese, overweight range. And then as you go up on the weight, you go up into obese and then morbidly obese range. And this is an important factor in developing breast cancer. We need to stay in this green zone, guys. Now, I know it's a very tight zone. I wish our zone could go up to, up here, but it's a tight zone because your body needs to be in a balance with the amount of fat that's present in there. And so we need to stay within this green zone. Next slide. So this is what BMI will look like. If you're under BMI for 18, you're going to be very skinny. Now, if you're over 24.9, then you get into the obese range. And when you're more than 30, then you're in the overweight and then the obese range. So you don't want to be in these two ranges. You want to be in this part. Now that's the hard part, guys. I know, believe me, we all deal with this. How can you stay at the skinny level? So it's not, even if you go a few pounds above this, it's not going to change a lot, but you never want to get into this obese range. And studies have shown, this World Health Organization and the Women's Health Initiative study showed that weight loss of 5% or more reduces postmenopausal breast cancer risk by 25%. So if you are 160 pounds and you lose 5% of 160 is 8 pounds, you will reduce your risk of breast cancer by 25%. That's better than taking a pill, guys. So please make it an aim for you to try and reduce some weight. Next slide. So how is obesity related to cancer risk? And that is my interest here. How does being obese cause cancer? And as you may have seen, Judy, in my last lecture, I had gone into much detail about how obesity causes cancer, but here we don't have as much time. But basically, obesity causes inflammation. Inflammation is bad. Inflammation, also obesity causes estrogen production in the fat in the abdomen. Because remember, after menopause, we don't have ovaries that are producing estrogen. So where is the estrogen coming from? It's coming from the abdominal fat. The hormone aromatase is converting testosterone to estrogen, and that's how you're developing cancer. Also, obesity is causing increase in insulin. I put it in red because I want you all to remember that insulin and insulin-like growth factors, which we think are only related to glucose control, in 2006 were found to be associated with cancer. Hyperinsulinemia, insulin resistance causes cell division, DNA damage, growth of blood vessels, and spread of cancer. Women who are diabetic have a 25% higher risk of breast cancer. So guys, each of you, I want you to go to your doctors, check your hemoglobin A1C. A1C indicates to you how good has your sugar control been over the last 3 months. You're going to be eating normal diet, but then you start eating a cookie every night. You may not think it makes a difference, but in 3 months, your A1C is going to spike. And that's called insulin resistance. So you want your A1C to be below 6.5 to make sure that you don't get into the diabetic range. And so that's extremely important. Even below 5, the normal A1C should be below 5.7, but 5.7 to 6.5 is the insulin resistance range. And after 6.5, it's going to be in the diabetic range. Next slide. So this is a diagram. I know it's a little complicated, but look at the top. You have genetic susceptibility. You have environmental factors. They get together to make you eat more. So environmental factors meaning access to food. We have more food available than our grandparents did, guys. We eat 6 times a day instead of 3 times a day. We eat when we wake up and we eat before we go to bed. We gotta stop eating ourselves to death here. Eating is causing us to develop inflammation. It's increasing the estrogen levels in the blood. It's increasing the insulin growth factor in the blood, increasing estradiol and testosterone activity and causing cancer. Also, this obesity is causing insulin resistance, increased blood sugar, increased insulin, DNA damage, and cells are growing. And so all this is causing cancer. It's a complicated model, but I think if you look at it closely in your time, take your time going over it, you will understand how they are all related. So your obesity is related to insulin, it's related to your environment. And so we gotta put a stop to this. Next slide. So this is one of my slides I like. So physical activity has been shown to be the miracle cure for patients who actually have breast cancer and also to prevent breast cancer. And that is physical activity. And I like this cartoon where this doctor is saying, would you rather exercise 1 hour a day or be dead 24 hours a day? I like that. And I use it sometimes especially some of my really resistant patients who will say, no, we can't exercise because of, there's snow outside or my knees are hurting. I say, do anything. If you can move your arms while you're sitting, you can do that, right? You're watching TV, pump your arms, move your arms up and down, get 2-pound weights, do something. Move your body, because what that does is it improves your muscle strength. It allows the insulin to get into the muscles, reduces the risk for breast cancer. Next slide. So physical activity and breast cancer risk, this is one of my passions, because I just think that this is something I'm going to be putting on a prescription for all of my patients. I do that now, but I'm going to be now making it more formal for them. Next slide. So next slide. Do you think this guy is at a higher risk, or the other one, the girls who are running? Obviously, this guy is at higher risk of developing breast cancer. Or girl, this girl or guy, whoever. Next slide. So federal guidelines for exercise. These are the guidelines by the government. 2.5 to 5 hours of exercise at moderate intensity per week, which means brisk walking is moderate intensity. When somebody's talking to you and you're walking and you can just barely talk, that's brisk walking. Now, if you do vigorous walking, which means that you can't talk, or you're running, or you're doing high intensity cardio, then you can do 75 minutes to 2.5 hours per week. Along with that, muscle strengthening exercises 2 more days per week. Please, I want all of you to remember this and start making this change in your life, because exercise, as I said at the bottom, is a form of treatment for breast cancer. 50% reduction in the risk of breast cancer coming back in women who already have breast cancer. 50%, 64% lower risk of dying of breast cancer if you exercise. So if this was a pill, this would be a miracle pill, as I showed earlier. Next slide. So there was a study done where in the European Journal of Cancer, they looked at physical activity, hormone replacement therapy, and breast cancer risk. It was a meta-analysis, meaning they looked at many studies to see the data and come up with the conclusion that most physically active women had a 12 to 21% lower risk of breast cancer than those who were least active. Guys, anything you do is considered activity. Anything more than just sitting in one place is considered activity. So start moving. I really like the next one, the next slide, where, oh, okay, there's another one, but we can go with this. How does exercise reduce cancer? It lowers estrogen, increases sex hormone binding globulin, which is the protein in the blood that binds to estrogen and lowers the estrogen level in the body. You want to have a higher level of sex hormone binding globulin, and being obese reduces this level. Not exercising reduces this level. Also, exercise reduces insulin levels by, I told you, by increasing muscle activity. The muscles are moving more. The insulin is more active. The insulin is allowing the glucose to enter the cells, so the insulin can do what it needs to do instead of you developing insulin resistance. Insulin resistance means that your insulin cannot promote the entry of glucose into your cells. So your cells start starving. There's glucose all over your blood, there's insulin all over your blood, but you cannot use that glucose because of the obesity and the lack of exercise. The insulin is not working. You want your insulin to be working. You want to reduce the inflammation, improve your immune function, and reduce obesity by exercising. Next slide. So this is a common myth. We think that after we can exercise, we can eat anything we like. So if you eat one slice of cheesecake, guys, I just want to tell you, it's 400 calories. How much do you have to run to burn 400 calories? You have to run 4 miles per hour to burn 400 calories. So you'll have to burn an hour running at 4 miles an hour for 1 hour to burn that one cheesecake slice that it took you 5 minutes to eat. Okay. So here's what I'm saying, and I love my cheesecake, believe me. Take a bite of it, take half of it, but eat it maybe once every week or something, not every day. That's the key. Now, this is the slide I was referring to. This is the initiative by this organization. I'm blanking on the name here, hold on. Where is it? So it's one of our offices of disease promotion and health prevention within the US Department of Health and Human Services, which has come up with these recommendations. But here's what they call them: move your way. If your way is just sitting and gardening, do it. If your way is just doing, running with your dog or walking your dog, do it. Walk, run, dance, play. Even 5 minutes of physical activity has real health benefits. Do what you can. This is what I want you to remember. Move your way. Do anything but do something. Do not be sedentary, because then you're talking about early death, along with heart disease and stroke and cancer and all that. Next slide. So going back to the World Cancer Research Fund, we talked about being a healthy weight. We talked about being physically active. I'll talk about the diet in a minute. And now we're going to talk about red meat and processed meats and consumption of sugar, sweetened drinks. We've already talked about alcohol. So next slide. So association between meat consumption and risk of breast cancer. These are findings from the sister study. This is a study that was done by the National Institute of Environmental Health Sciences. They looked at 50,000 women between the ages of 35 and 74 whose sisters had breast cancer to see what are the environmental factors that are causing these women to develop breast cancer. And they did 7.6 years of follow-up. And here's what they found. Increased consumption of red meat increased the risk of breast cancer by 23%. And substituting poultry, meaning chicken, reduced the risk by 15%. So red meat has been labeled a level 2 carcinogen by the World Cancer Research Fund that I mentioned earlier. Next slide. So this is another slide where, because of the animation, you can't see it because the animation was supposed to come at the end. But you have at the left-hand corner, you have hot dogs, and so see if you can do that. So animation comes after with the next click. Okay, that's fine, just leave it. So you have hot dogs, go back. Hot dogs, you have a steak, you have grilled meat, and then at the bottom you have sugary drinks and burgers and fries. All these foods are inflammatory foods, guys. Inflammation is bad. Inflammation is bad. So there's fire in your belly. What is inflammation? It's increased temperature in the body when you get an injury. But now we are getting in this increased inflammation all the time, even when you're not have an injury. So it's called chronic inflammation. Inflammation promotes cancer. We gotta get rid of the inflammation. And one of the best ways to do it is to stop eating inflammatory foods. Next slide. So now I'm going to show you where you all want to be right now in this beautiful, cold, sunny day. This is the Mediterranean Sea. And this area marks all the countries that are around bordering the Mediterranean Sea. By the way, I grew up, part of my childhood was in Algeria, which is and I lived in Algiers, right on the Mediterranean Sea. And yeah, right here. And so over there, they eat food that is more plant-based, but also has more olives, more nuts, and I'll show that to you in a second. But this guy, Ansel Keys, he's an American physiologist, found out that these people had the lowest risk of heart disease and cancer. And he was wondering why that happened. And what they found is, next slide, is that these people eat in a group. They don't eat alone. And by the way, these are the foods we say we should be eating, the colored vegetables. And somebody showed me this one day, that these are the colors that we should be eating. Not really. These are not the colored foods I'm talking about. The Mediterranean people eat the colored foods. Next slide, which is, if you look at the right-hand side, it's made up of all these colorful, beautiful vegetables. And they eat in a group with their family, because family eating, social eating, results in you eating less, in eating more wholesome, healthy food, and also reduces your risk of eating more fast food. Now, the Mediterranean diet that I'm going to talk about, so don't go on right now. Mediterranean diet is focused on eating less meat. So they eat more salmon, more fish. They eat the colored vegetables. They eat all these cruciferous vegetables, we call them, the Brussels sprouts and the cauliflower and the broccoli. They eat more, they drink more olive oil and avocados and spices. Next slide. And these are anti-inflammatory diets. So here's what we're going to talk about. Less meat, more fish. Think of your meat as a lobster. Do you eat lobster every day? No. you eat lobster maybe once a month, maybe twice a month, maybe once a year. You should be eating meat about once or twice a month. But if you have to, like we all love our meats, maybe eat once a week, not every day. More fish, more poultry. Healthy fats are good. Now, we always say don't eat fat, but I believe the fats are more important. They have omega-3 fatty acids that help keep your cell membranes pliable and flexible. So take more olive oil, avocados, and nuts. Cruciferous vegetables, and these are, by the way, the nature's own medicines against cancer. But these are called the phytochemicals that are present in Brussels sprouts, cauliflower, kale, broccoli, cabbage. These are called phytochemicals. These chemicals prevent cancer. And the cruciferous vegetables have something called sulforaphanes that has been shown to be an antioxidant, anti-cancer drug, and also has a lot of fiber. Fiber is good for your gut to prevent cancer. Carotenoids are the next one, which are carrots, squash, sweet potatoes, are orange vegetables. So the previous vegetables are more green. These are more orange. They have chemicals in them, the carotenes, which are important for cancer prevention. Berries have been shown, especially blueberries, are called nature's own drugs to prevent triple negative breast cancer. Berries have all these phytochemicals, these colored phytochemicals are present to prevent cancer. Onion and garlic have, again, chemicals that will help you live a healthier, cancer-free life. Spices, instead of salt, turmeric has been found to be one of the nature's chemicals that has been studied the most often and is found to be an anti-inflammatory drug. I give turmeric to my patients who have joint pains now instead of taking Motrin or Tylenol. Why not take something natural? Cumin, cinnamon, all are spices that are really good for you. Fiber, I have to emphasize a little bit. 40 grams for fiber per day is essential to keep your gut bacteria happy, guys. We need to keep our gut bacteria happy. Gut bacteria are there to help you digest your food. Also, they're there for many other reasons, and we'll talk about it in a second. But fiber, 40 grams is essential. And then green tea. Green tea has a chemical called ECGC, which has been found to prevent breast cancer. And 3 to 4 cups of green tea is recommended. And water intake, about 9 to 10 glasses of water a day is recommended, because water will purify all the toxins out of your body, will help your joints stay lubricated. And for me, water helps my brain stay hydrated. Because even if I don't drink water, like I haven't had time today, I know I'm going to start getting tired in about a couple of hours. So when you get tired, instead of going to pick up your coffee, drink 2 glasses of water. Make a water drinking part of your routine also. Next slide. We are reaching 12:30. So this study showed that people who consume fruits and vegetables, and they had to consume it for at least 8 years, had a much lower risk of breast cancer by about 11 to 12 to 21%, as opposed to women who did not consume fruits and vegetables. Next slide. So the gut bacteria I was talking to you about, remember there's a whole new organ that's sitting in our gut that's called the microbiome. It's made up of viruses, bacteria, and you guys all know about viruses now, guys, right? The COVID virus is all around us. We want these bacteria in our body to be the healthy bacteria, that it will keep our body happy and not be sick and unhealthy. And believe me, our gut bacteria can play a huge role. Next slide. This is what they do. They extract energy from food. They make you eat more or less. People who have been found to be heavier have different gut bacteria than people who are leaner. And if you take the bacteria from the leaner people and put it in the heavier people, they will become leaner too. So our bugs are telling us what to eat, guys. We are letting these little bugs help us maintain a balance with the environment. They provide a barrier protecting us from invaders. They develop our immune system. They help prevent leaky gut syndrome, so that the bad toxins in our diet and the bacteria in our belly don't go into our bloodstream. And they affect our mood. Happy bacteria, happy mood. And 90% of the good mood hormone called serotonin is produced in our gut, by the way, and it's produced by these bacteria. Estrobolome are the bacteria that have the ability to metabolize estrogen. And if you can break down the estrogen, then less estrogen is absorbed in the body, and then you have lower levels of estrogen. But if you don't have this, these good bacteria, then you will have higher levels of estrogen in the body, and you will then end up having a higher risk of breast cancer. So next slide. So this study showed that high fiber diet promotes the growth of bacteria that break down estrogen. We want to take a high fiber diet. We want to have the good diet that will feed your good bacteria in your body. We want to eat an anti-inflammatory diet. Next slide. So another thing I want to mention quickly is vitamin D. Now there's a lot of information out there about vitamin D, if it prevents cancer or not. There's some controversial information about it, but we do know that the very low levels of vitamin D do increase the risk of breast cancer as opposed to high levels of vitamin D. And then there's an 80% lower risk of cancer compared to women who have low levels of vitamin D. We also know that women who have breast cancer have a higher risk of dying if they have a lower level of vitamin D. And we now all know that with COVID, we have low levels, we are more likely to have more severe COVID and be placed on a ventilator. So please find out your vitamin D levels. So I don't want you to go out and buy vitamin D. If you can sit in the sun for 15 minutes, 3 times a day, that will make you enough vitamin D to help you for the week. But if you can't do it or there's no sun outside, then check your vitamin D levels. And if your levels are low, go ahead and get some vitamin D supplements. Next slide. And so in summary, you are responsible for your health. Understand your risk for breast cancer, take charge and make changes to reduce your risk. Learn about testing that can be done in addition to annual mammogram, like the test I talked about, the automated whole breast ultrasound, or an MRI, or genetic testing, or going to a medical oncologist to get information about chemo prevention, because as Gandhi said, it's health that is real wealth and not pieces of gold and silver. Thank you guys for your time and attention. And so we've covered most of this, except it says here that do not use supplements for cancer prevention. I completely agree with this. Do not be taking green tea supplements, drink your green tea. Do not be taking carotene supplements, eat your carrots, eat whole food, breastfeed. And if you have a cancer diagnosis, then also follow these recommendations, because they will help you live longer. Thank you, everybody, and God bless you. And I'm so sorry for this this glitch in our system here, so apologize. Thank you.
Dr. Bhatti, I know that you...
No, it's okay. I'm going to give you 10, 15 minutes because, you know,
okay.
It's fine.
I'm
going to drive fast after that.
Okay.
Thank you so much. It was great talk.
Oh, you're welcome. Announce yourself.
I'm Sarita Goyal.
Nice to talk to you.
Nice talking to you.
Question?
I admire your enthusiasm for prevention, you know.
Thank you. Thank you.
I have a question. Every time I get mammogram done, they always say dense breast.
Mm-hmm.
So I worry about it, you know.
Yes.
So but they have never recommended ultrasound or anything,
right.
You know.
So here's what I'm telling you. Use that worry to convert it into being proactive. So look at your breast density, because they send you a letter, right? It says dense breast. You tell them that, you know, there's data out there saying that patients who have dense breasts have a 3 to 4 times higher risk of breast cancer. You can hide a lot in this breast. Can you please send me for an automated whole breast ultrasound? That's when the physician will know that you are an empowered patient. You know your stuff. And then you can help them make the decisions for you, because everybody is not familiar with all this information.
So request for automated
whole breast ultrasound. Yes.
Ultrasound. Okay.
Yeah, most organizations have it. Some of them don't, but still you can even do a whole breast ultrasound by a sonographer if they don't have that machine. Whole breast ultrasound is done with automatically, where they take a plate and bring it down instead of having somebody hold a probe around your breast. So you could always do that, but take charge of your health. That's what I want all of you to do.
Yes, I always worry. I know dense breast is they are predisposed to more cancer.
Yes, right. 3 to 4 times.
I always wonder about it.
Yes. So now you know.
Thank you so
Okay,
much.
I also have a question regarding the whole breast ultrasound.
Announce
Can that
yourself.
be? Hi, my name is Rose.
Hi, Rose. How are you?
I'm well.
Good. Good.
So my question on whole breast ultrasound.
Yes.
Can that
So
be done together with the regular mammogram, or does it have to be a separate procedure?
So it has to be a separate visit, because remember now our radiology colleagues also have to be reimbursed for their testing. So the insurance companies may not reimburse them if they're all done at the same time, especially Medicare. So that's why I think they do want you to do them at a separate visit. And that's my understanding. Otherwise, obviously, so most radiologists don't read the mammogram at the same time when they are done, right? They'll take them a few days to read them. And by that time you're gone. So that, you know, ideally that would be great, but I think it's important that at least get it done, even if it is at another appointment. Does that answer your question? Hello?
Okay, thank you.
Okay.
So I have a question.
I guess I'm
You said
just surprised that my doctor, who knows my breasts are also dense, so I'm surprised that the doctor doesn't.
I'm sorry, I missed her.
There was someone else who was talking along the rows. That's Ava. She's asking, when should you stop mammograms at what age?
Okay, that's an excellent question. And so women now, if you look at different guidelines from United States Preventive Service Task Force, American Cancer Society, etc., we are all saying that if you are healthy person, you have a life expectancy of more than 10 years, you can go ahead and get mammograms as long as you want to. So my rule of thumb is, if a patient comes to my office who is all looking good, who's all dressed up to come to see a doctor and says, I want my mammograms, I will say, go ahead, because I know that this woman is healthy. Now, if you are in a wheelchair, you are in a nursing home, or you have many other comorbidities, like you have, God forbid, stroke or some kind of a terminal disease, then I would not recommend mammogram. So generally, you know, if you are healthy, you can get mammograms up to whatever age. You don't have to stop at any age. And I know some of my patients get upset because their doctors are going to say, oh, you're too old for a mammogram. But if that doctor thinks that that patient cannot handle surgery, because that's the point, that if you get a mammogram, it shows a cancer, then you'll have to do something for it, like maybe surgery. But if they cannot handle the surgery, then there's no point in doing that mammogram. But if they are healthy enough, I had a 95-year-old recently who did not have a mammogram, but had a lump in her breast, but she lives alone. She takes care of her own house. So her son brought her to me and said, she has this cancer. What should we do? I said, ask her what she wants to do. If she wants me to operate, and I can do it under local anesthesia, and she's going to be fine. So that's kind of where it boils down to. How much can you handle in terms of further intervention? And what's your life expectancy? So that's what we're looking at. And everybody, you know, we can't predict everybody's life expectancy, but we kind of have a sense of how well we are. And if you are in good health, you should be able to get your mammogram. You're not old at any age. You're only as old as you think you are. Especially my 80-year-olds usually think they're 60. So no reason not to get a mammogram.
I think that's fitting for our group. Do we have any more questions?
I think that Joy had it, yeah.
If there is any history of cancer in the family, is that, doesn't matter what kind of cancer it is. So does that increase chances of breast cancer in you? Because or is it breast cancer only?
So as I said before, it's usually ovarian cancer and breast cancer go together. Also prostate cancer, male breast cancer, premenopausal mother or sisters with breast cancer, or Ashkenazi Jewish ancestry. Other cancers can be related to other genetic mutations. So we are not just testing for the BRCA 1 and 2, we're also testing for multiple other genes. There are multiple other genes out there, guys. There's the CHEK2, the PALB2, the P53. So these genes can be tested. So if you have a strong family history, what we recommend is that person who develops the cancer should be tested for the gene. If you do not have cancer and don't have a family history of breast or ovarian cancer, then you probably would not qualify for genetic testing. Yeah, unless you develop cancer. Yeah.
Thank you so much.
There was a question, Judy, about
From
somebody's
Deanna.
sister. Yeah.
Sorry, she wants to know if her sister had breast cancer at the age of 50 and passed away, should she be doing more than just mammograms?
Of course. This is the person who needs to go for genetic counseling. She, unless her sister was tested, I don't know if her sister was tested and was found to be negative, then she should, but still I would recommend if she had a premenopausal sister, she should be tested for genetic testing. And then if she tests positive, then her family members, including her siblings and her children, should also be tested. So we have genetic counselors available now. They're not in each hospital, but we have them available in different organizations. Advocate has one, Amita has one, and they can talk to you on telemedicine, send you a kit that you can take your own swab of your DNA, send it back to them. So be proactive about it. But I would do her genetic testing. I would be getting at least a mammogram and looking at the density. And if it's a dense breast, I would recommend an MRI, because this woman's risk of breast cancer is more than 13%. It's probably over 20%. So that's why we have these high risk clinics. So, we in hospitals where we have these accredited programs, like we have an accredited program at West Suburban Hospital. So we have our radiologists looking at mammograms and then coming up with scores of what's the risk for this patient. And if the risk is over 20%, then these radiologists are recommending annual MRI on these patients. And then they come to us with this information. So I would say take charge of that part of your history. And, hopefully that'll give you some information, because knowledge is power. I want to know if I'm going to develop breast cancer. If God forbid she has the mutation, this person, then she can take proactive actions against it. She could get her ovaries out. That will prevent the risk of ovarian cancer. She could do just annual MRI, or she could do bilateral prophylactic surgery. But I don't jump to surgery right away, even though I'm a surgeon. I love operating. But I would not want to remove the breast right away unless I can kind of assess the risk. The older you are, the less likely, if you have a BRCA mutation, that you will develop another cancer. So I had a 70-year-old recently who I did a lumpectomy for breast cancer. She has the BRCA mutation, but I said, I don't think you need both your breasts removed. You're 70, let's watch you. So we're going to get an MRI on her every year. So does that answer your question?
I wonder if they can unmute.
Yeah, somebody's muted, Deanna.
No, Deanna's out. I just asked unmute.
No, that answered my question. Thank you.
Okay.
Good.
Any other question? Oh, did you say, Judy, anything about folate? You said there was a question about folate.
Folic acid. So I was reading something pertaining to that, and how if you have too much folic acid,
yes,
it can contribute to breast cancer or cancer.
Right. So it's actually this World Cancer Research Fund that I mentioned to you earlier. They have an investigator, a researcher that's actually looking at folate and folic acid. And what she has found out, based on, this is now on animal models. So they look at mice models. And so they found that when you supplement folate, when they are growing, when they're compared to in humans, it's like puberty, giving folate or before puberty is helpful to reduce the risk for cancer. But if you supplement folate in an adult mouse, they have a higher risk of breast cancer. So folate has a U-shaped curve with cancer. So I believe now, and we recommend folates for pregnant women, but we don't want everybody to be overdoing on folate. So that's why we don't want to be taking supplements. We want to be taking all these healthy vegetables. The phytochemicals will work with the fiber. They will not allow things to get in excess of in your body. So get out of this mindset that one pill will take care of everything. We got to put in the work, got to make the food so that we can eat it and get the nutrients to build our body. But these nutrients have their own intelligence, which you cannot put it all in a pill, because the pill will make it in a very concentrated form. And I believe that that may cause more harm than good in the long run.
And I'm glad you said that, because January, the first week of January is the National Folic Acid Awareness Week. But I work with Medicare clients, and I see so many doctors prescribe folic acid supplements for the patient. And it just, when I saw this as with the awareness week, and then I remember all the medications and prescriptions that I see people prescribe, it's like quite alarming.
I know. So we got to keep on top of this research. And I'll send you that paper by the World Cancer Research Fund on the folic acid. But, it's hard to keep track of all this. And that's why I think we as healthcare providers have a duty to our patients to educate them. And instead of just writing, which is, before I did this fellowship, I would just say, okay, you have, cancer, let me take your breath off. But now I feel like I want to prevent it from happening again, because eventually in the long run, this is what's going to help the patient. This is what we took our oath for, Hippocratic oath, when we became doctors. We said, do no harm. And now with all our interventions, sometimes we are doing harm, instead of, but it's a combination of time. A lot of people doctors don't have the time, the reimbursements. It's a different, environment now, but that's why I concentrate on breast only. Because before I would be doing everything, and I realized that my patients need more time. So I will give them more time, but it's hard for every provider to do that. They also have to make a living. So I tell my residents, I teach residents and students too. So I tell them, when you become doctors, set another appointment for the prevention. You can always have another appointment and say, we'll talk about prevention. But a lot of times patients don't even want to hear about prevention, because that's where the hard work comes, where you have to put in the exercise and the work. And so they'd rather have a pill for it than talk about, healthier lifestyle. So that's
Dr. Andrew, I'm a fan of Dr. Andrew Weil. He's such a, so did you get to meet him?
Yes, I actually did. And he gave us lectures, and he's a great guy. And he actually hosted us in Arizona, where his chef made food for us. And it was all organic, like they grow their own vegetables. And so they would make it, and it was delicious. And I'm like, why can't I make food like this when I get home? But, it's hard to grow your own vegetables when you're a surgeon, but he's a great guy. Yes. And very, very sort of forward thinking person who 20 years ago started this program. So now this integrated medicine program educates doctors. So we were 80 MDs, we're not.
So how long is the fellowship?
2 years. It's an online fellowship, but then we stayed in Arizona for 3-4 weeks out of that time to meet them. And also, it was wonderful. And it was a nice change for me to change from my, go mode to more of a, preventive, holistic view of medicine.
I read some books, and he's big in yoga, on meditation.
Yes. So that to me is another passion that I have, is trying to calm my brain, meditation. But I haven't had a talk on it yet, because I don't think I know enough about it. But he gives us wonderful talks, and we had speakers about yoga and meditation. But your mind affects your genes also, guys. Remember that epigenetics, where those methyl and acetyl groups are attaching in the histones. When you think in certain ways, our DNA is changing. Elizabeth Blackwell is a Nobel Peace Prize winner of this research that showed that using mindfulness-based stress reduction increases the size of your telomeres. Telomeres are the ends of chromosomes that help the chromosomes to stay together and not unravel, sort of like shoelaces. So these are the ends of the shoelaces. And if you think good thoughts, our telomeres grow. Come on, isn't that awesome? But it's so hard to remember that when you're in the middle of all these negativity and all the drama that's going on in our lives. But we have disconnected ourselves from our bodies. We are just too much. And I think that's why we needed this break. I mean, I know we have had so many deaths. We have had 400,000 deaths and so many cases of COVID, and we'll never go back to who we are, because I think we needed this break. We all need to use this time to reset ourselves. start us on a new journey, because we cannot let a virus take over us like it did in this country. You go to other countries, and I was in Pakistan 3-4 months ago, and it's like there's nothing is happening there. Their numbers are lower than of the whole country are lower than in Illinois for deaths from COVID. So, you know, there's something that we did differently to ourselves here in this environment, and we need to change that mindset, become more connected to our bodies, use our mind to calm ourselves down, not be so judgmental, not be so opinionated about things. Let others kind of be part of the conversation. We are all the same inside, you know. I cut people every day. Inside, we are all the same. Yes. There's no difference. You know, everybody's organs, everybody's tissues are the same. So we just are all in it together. Let's all learn from this and grow on to become, you know, a healthier nation and a healthier population. Thank you, guys. I really got to go now. I have office at 1:30, so I have to drive back.
Thank you, Dr. Bhatti.
Thank you.
Okay, you're most welcome.
Thank you.
We love you.
You're welcome. Thank you.
Thank
Bye
you.
now. Bye now.
Bye.
We'll talk later. Bye.
Yes.
Thank you, doctor. It was very informative.
Welcome.
Thank you.
Yeah, I'm glad you liked it. I'm sorry I was talking